In just 11 days, can you believe it? Family and friends will come together to celebrate Thanksgiving. But because of these gatherings, health experts are urging everyone to get vaccinated. According to the CDC, the U.S. is seeing the highest flu hospitalization rates in a decade for this time of year. So far this season, the flu has already claimed 1,300 lives in the United States. On top of that, other respiratory viruses, including respiratory syncytial virus or RSV, are also spreading early and rapidly. It's now responsible for an estimated 1 in 50 deaths in children under the age of 5 worldwide. And joining us now to talk about the best way to combat these viruses is Dr. Shalika Katuka, right?
Correct.
Yes.
Beautiful.
Okay. She is joining us from Baptist Health, and you have a lot of knowledge on this. Tell us, first of all, why is this flu season, do you think, so far so bad?
Sure. So it's multifold. So one of the reasons is that in the past 2 years, we've had restrictions. We've been out of school in terms of not in person,
right.
And now we're getting rid of masks. So what these restrictions did for us in the past 2 years is not only slow COVID, but also slow flu and RSV. So now that we're getting rid of these restrictions, we're seeing these other respiratory diseases on the rise. So also because of the pandemic and restrictions, we didn't develop immunity as a community to flu and RSV. And so again, that's why we're seeing severe manifestations now. And finally, we are seeing a lag in flu vaccinations compared to past seasons, so we aren't as vaccinated. So.
You know, it's just anecdotally, of course, but I have talked to a lot of people who have a little bit of vaccine fatigue because there's so many COVID vaccines that they're not wanting to get the seasonal flu shot. But really, if there was ever a time to get one, it would be this year.
Correct, and it would be now, so because of the severe flu season. So the flu vaccine helps you from getting severe disease, which means it prevents hospitalizations and death, and it prevents you from getting sick from the flu. And then the time is now, because we're 2 weeks away from gathering with our loved ones, which
right.
I'm so happy that we're able to do.
Yes.
It actually develops, it takes 2 weeks for you to develop antibodies after getting a vaccine. So the time is now to prepare for Thanksgiving.
And let's talk a little bit about RSV. I know my daughter had it when she was 5 months old and spent a week in the hospital. It is horrifying because your child can't breathe. And so we're seeing a lot of it right now, aren't we?
Yes, we are. So we've seen an early rapid rise in RSV compared to past seasons, again, for the same reasons we discussed. And, you know, at Baptist, we're seeing what mirrors national trends as well.
What's your advice to pregnant women who might be watching right now?
Sure. Pregnant women should definitely get the flu vaccine. You can have severe outcomes of flu from being pregnant, and the flu vaccine prevents flu in mommies and in babies in the early stages of life.
And a newborn can't get a flu vaccine, so the mother has to get it before the baby's born,
yes,
right?
You have to be 6 months.
What should parents in general be most concerned about during this season?
Sure. So you must have heard the word triple-demic, which means a rise in COVID, RSV, and flu this winter. So what you can best do to protect yourself is to get 2 of those diseases have vaccines available. So the flu vaccine for anyone over 6 months, and the COVID vaccine for anyone over 6 months, and the updated COVID boosters for anyone over 5 years. Other things to do, make sure you're washing your hands often and for at least 20 seconds with soap and water. Decontaminate commonly touched surfaces like doorknobs. You know, if your child is sick, keep them out of school and out of the community to prevent spread. If they have a hard time breathing, seek care.
Right. Well, these are all things that we learned in the last couple of years, so we know how to do it.
Yes.
All right. Dr. Katuka, thank you so much for being with us.
Thank you again.